Hello class, my name is Jody Todd and I'm here today to speak to you about the strategic plan for bedside report. I'd like to thank Dr. Barry Atkins for all of his support throughout the class, as well as yourselves in listening to all of my presentation. Throughout this presentation, we'll be going over the bedside handoff and improving communication at the bedside, review statement of the problem, overview of the project, review of the SWOT analysis, mission and goals, strategy plan, drivers for organizational success, process impact, stakeholder analysis, perspective, learning and growth, action plan and strategy, evaluation of the strategic plan, and a conclusion. Healthcare is an ever-changing field with focus on the client. This connection between evidence-based practice and organizational goals are seamless. Focus on this continuum supports an increase in client satisfaction, improved safety for the client, and fluidity within the dialogue from shift to shift, department to department, and facility to facility, ensuring the connectedness within the organizational handoff. Ineffective handoff can contribute to gaps in client care and failures in client safety, including medical errors, medication errors, surgery performed on the wrong site, and even death. Transition of caregivers during handoff are complex and vary between nursing staff based on many factors, from educational gaps to communication differences from nurse to nurse. However, standardizing the handoff procedure promotes the opportunity to ask questions from not only the nurse, but also the client and the family. Connecting the client and family in their care delivery is platinum. This connection supports clients, families, and their involvement in education and of the plan. Transition of bedside handoff report is essential in providing the best possible care for the client. This method covers a connectedness to the plan of care, including code status, history, allergies, physicians, medications, assessment findings, IV lines, tests, results, discharge planning, and involving the client and family in this process. This project will review the SWOT method of meeting organizational goals, including strengths, weaknesses, opportunities, and threats. Through this strategic mapping, action plans, communication, evaluation, and finally presentation of the findings, the bedside handoff will create a culture of active participation in nursing, education for the client, improved client satisfaction, and fewer adverse events related to poor compliance and communication during handoff. This SWOT analysis on how to improve communication during shift handoff includes the strengths, weaknesses, opportunities, and threats. Please review the content. In Honoring Health, our mission statement is to improve the health and well-being of those we serve. Through a connected community, improving the health and wellness. This connection within an organization supports and develops a holistic treatment plan that involves the client, family, and team to ensure confidence through the wellness and illness process. Stakeholder goals for developing a working relationship between bedside nurses and clients, developing trust within dialogue, involve them in their care through a connectedness of strategic medical exchanges, developing and meeting the expectation toward enhancing the experience. This strategic map accomplishes the mission and creating of value through financial performance, customer service, internal process, learning, and growth. Organizational success supports the ability for connecting the insurance companies for potential growth and retention in care. This bond between insurance and healthcare sets the stage for overwhelming domination for public healthcare. Accountable care organizations are leaders in developing healthcare initiatives based on measurable goals for health, wellness, and prevention. This development has enormous impacts of organizational success. Consumer demand within the community supports the developing communities they rely on for healthcare, especially in a poverty-driven area. Word of mouth and preventative medicine is essential in keeping individuals healthy. Innovation and research-based progression of medications support our healthcare model link, identifying and progressing with care delivery from a connected approach in the electronic medical record. Operational process impacts continue to be an overwhelmingly important process tool to connect business stakeholders into the infrastructure of cost, process, and framework within organizations. Measuring outcomes set organizational goals to standard. The understanding ignites change agents into what has the potential to create impacting delivery, satisfaction, overall cost saving, and revolutionary new developments in healthcare. In my organization, we have an ACT team that evaluates change based on employee input. Through this initiative, cost, time, safety, and satisfaction are associated with our success. Stakeholders come in a variety of arenas, from the providers of healthcare, insurance providers, self-pay clients, employers choosing plans for their employees, to the actual client receiving care. Stakeholders are essential in creating a check and balance system to ensure quality care delivery upon pre-hospital, inpatient areas, and post-hospitalization. Through this connection with the stakeholders' commitment to excellence enables all to be accountable for organizational goals and standards of care. In Bedside Report, providing input at all levels through establishing accountability serves not only the handoff, but also educational opportunity and support from shift to shift. Action within an operation is essential to connect direction review, ongoing input, maintaining accountability, advising on education and concerns for the client, and support a strategy for enhancing the experience to become involved in care delivery through modeling the exceptional care that is deserved. Strategically speaking, handoffs are held to a different standard at all facilities. With this knowledge, it is essential to create communication between not only the nurse to nurse, but also involving the client and family. Decreasing the risk for error is essential in caring for others. This educational opportunity sets the standard for safety through knowledge and accountability, which leads to a decrease in stress and enhances the communication between client, family, and nurse. Stakeholder analysis uses a powerful tool to keep patients satisfied, manage them closely, monitor their progress, and keep them informed. Financial stability within an organization is essential to growth and care delivery. Accountability within handoff supports a decrease in errors through involving the client and family to ensure accurate information is expressed. Litigation for medical errors are a direct reflection of prevention of errors prior to implementation of care, as well as the pathway for individualized care. Customer satisfaction today is more important than ever with a continuous influx of information via internet and word of mouth. Through these efforts to bring business to hospitals continue to influence the financial advantage through high consumer satisfaction scores and positive experiences in facilities. Involving the client in their own care begins with the admission process. This insight into care supports the importance of client care and improved compliance through leading and decreasing the readmission rates. This principle is also reviewed as a Medicare non-payment for specific readmission diagnosis. Customers in today's busy world acknowledge the Bedside Report as a time to improve care, connect with the new nurse as a partner in their care, seeking out the important aspect of involving the client to be a part of amending care inaccuracies, as well as taking on the ability for a passive approach to care through family opportunity to engage in the process or when a request for rest is desired. Connecting the internal environment stems plenty of opportunity for growth personally, professionally, and for future experiences. This internal perspective guides care and supports on many levels from the stakeholder to clients. With this expansive window of opportunity, it is the right thing to involve the nurse, client, family, and promote opportunity where it begins, at the bedside. Learning and growth support the mission to guide care. Directors visualize compliance within their own departments, identifying the high motivation to ensure the highest quality care from leaders based on evidence-based practice. Accountability begins with oneself identifying the right thing to do. This enhances the handoff with tools that hold vital information related to client care. Learning happens everywhere, with opportunities to learn from each other sometimes takes us out of the comfort zone, stemming curiosity and learning from others. Accountability for compliance during handoff is derived from each and every bedside nurse ensuring the success, applying the foundation for every interaction to build from one another while delivering the highest in quality care. Stakeholders assist in the developing and transition to support and trust within all parties, providing a strategic medical exchange backed by a connection to meet and exceed the expectations of the consumer, family, treatment team, and promote wellness within the community. Departments within the strategic plan involved in the transition of care comprise the nurse-to-nurse handoff, nurse-to-technician handoff, doctor-to-nurse updates on the plan of care, new treatment plans, and nurse-to-nurse client-to-family. Dialogue is essential in the connectedness within the plan of care delivery, supporting each and every interaction, promoting question and answer sessions for the plan of care to remain clear for all parties involved. Business function impacting on the plan include management, competitive advantage, contingency planning, building scenarios, crisis planning, and innovation. Management in objective means the standing plans are essential in impacting the plan. Management supports and develops opportunities for learning and decreases in errors during handoff through activation of policy developed through evidence-based research. Competitive advantage sets the standard of care to work with the client in their healthcare at all levels is powerful for those caring for the customer, client, and family entrusting the care of their loved one. Contingency planning, seeking out the risk for litigation, prepares organizations for the worst. Bedside handoff impacts flow, involving individualized care, placing the client's management at the peak of what was once thought of as a disaster in the making. Prevention of disaster is preparing for caring in the client through knowledge of every aspect of code status to past medical history. Building scenarios in bedside handoff requires an acknowledgement of the need, with the understanding and developing evidence to support the cause is essential in healthcare. Changing practice needs support not only within the organization, but also within the industry. This support is found in research, technology, stories, and most importantly, those that are affected when the handoff is inadequate, leading to errors and even death. Crisis planning seeks out an evaluation of everyday mishaps, creating a plan that connects those in the line of crisis and how to alleviate the situation to prevent a crisis in future events. Innovation in today's fast-moving market requires brainstorming with a connection. It allows employees to become involved in their departments and feel as if their voice is powerful in the transition of care. Action within an operation is essential to connect direction, review ongoing input, maintain accountability, advise and educate on concerns for the client, and support a strategy for enhancing the experience to become involved in care delivery through modeling exceptional care that is deserved for each and every client. Impact on the action plan revolves around insurance companies, accountable care organizations, customer demand, and innovation and research. Organizational success supports the ability for connecting the insurance companies with potential growth and retention in care. This bond between insurance and healthcare sets the stage for overwhelming domination for public healthcare. Accountable care organizations are leaders in developing healthcare initiatives. based on measurable goals for health, wellness, and prevention. This development has enormous impacts for organizational success. Consumer demand within the community supports the developing communities that rely on their healthcare, especially in a poverty-driven area. Word of mouth and preventative medicine is essential in keeping individuals healthy. Innovation and research-based progression of medicine supports our healthcare model link, identifying and progressing with care delivery from a connected approach in the electronic medical record. Through this integrally related process, matrices are processed together with a combination of solutions that support the effort to ensure bedside report handoff is secure and accountable for every business function. Supported goals, costs, and benefits stir business ventures into action through return on investment that is visualized by return clients that feel appreciated and connected with their care through support from a team approach that draws them in and having a voice in their care. Strategically speaking, handoffs are held to a different standard at all facilities. With this knowledge, it is essential to create communication between not only the nurse to nurse, but also involving the client and family. Decreasing the risk for error is essential in caring for others. This educational opportunity sets the standard for safety through knowledge and accountability, which leads to a decrease in stress and enhances the connection between client, family, and nurse. Leadership strategy within the organization seeks results through accountability. This is demonstrated through behavior. Employee populations that do the right thing with a sense of ownership creates an importance in what they do through supporting work in an hour mentality of supporting strategy through action. Team collaboration within the organization must emphasize the importance of creating widespread connectedness to ensure pertinent, essential information during handoff is delivered efficiently. This team collaboration supports communication, decreases in errors, the opportunity for education, promotion of safety, decreases in stress within the team through knowledge in a relevant aspect through the plan of care. Strategy implementation in developing programs based on communication and fact create organizations demanding highly credible communicators that focus directly toward the goal of 100% of all bedside report being delivered based on a team approach developed within the nurse to nurse, patient to nurse, family to nurse, as well as the physician component when available. Formal communication developed within the team approach are the standard of care demonstrated by the organizational policy. The standard of care delivery must be completed at the bedside within the communication circle of the patient and family and questions permitted. The care team must review the plan of care, medications, review of the intravenous lines, drainage tubes, patient history, code status, and any finding on request from the nurse, patient, or family. As well, informal communication of the interaction may be away from the bedside for a review of sensitive aspects of care. For example, past medical history that the client requested no sharing of confidential information for friends and family, i.e. drugs or alcohol indicators, and anything that may be sensitive to the patient. Informal communication is essential for the handoff, however, not for formal documentation or knowledge for visitors. Plan insight requires communication, knowledge, and achieving the goal. Communication within the handoff delivers challenges. However, when revealing valuable information that is not a part of the chart just by acknowledging the patient, the interest becomes reality. For example, medication drips are reviewed not only for patient safety, but also for assessing and gaining knowledge of the drug. This was found to be saving of a patient's life through a review of the correct setup of a medication at the pump. Errors occur and can lead to detrimental outcomes. With this known knowledge, powerful preventions can be placed instead of mistakes, and in this case, the relevant new insights developed a priority in patient safety and connectedness in handoff delivery. Knowledge of the plan assists in a smooth transition of care and develops a safe and professional shift in care. Evidence of organizational accuracy supports the recommendation for 2 patient identifiers to actively involve themselves in the communication with the goal to improve the effectiveness of bedside report handoff. Achieving the goal requires a structured action plan to accommodate for organizing, developing, and evaluating the program. This specific measurable goal, reflective of channeling the bedside report and engaging the team of their roles in the plan to assist in developing and executing the plan. Energy must be placed on goal pursuit, requiring effort and team players that are in support of the goal. Guiding the task entails a team that can answer the what, who, when, where, and how of achieving the goal in 100% involvement in bedside handoff. Evidence of the vision includes developing a sense of global impact, developing champions at the bedside, and knowledge of the expectation. Developing a sense of global impact on a better future in care delivery beginning at the bedside is essential to caregivers creating a passion for decreasing errors, learning opportunities, engaging the patient and family involvement in their loved one's care, supporting the sense of ownership for the profession, the devotion to organizational goals and standards, as well as a vision for health and wellness. Developing champions at the bedside enhances the policy and promotes the level of care and handoff. Bedside nurses have the power to improve the safety and quality through engaging their patients at the bedside. Examples of involving those in their care are reflective of the teach-back method, demonstrating learning based on patient understanding and ability. Autonomy in care for those in the critical care areas are limited, relying on family members and loved ones to advocate. However, when able, nurses engage the patient in handoff demonstrated by neurological assessments, ensuring no change in what is observed previously are not deteriorated. Knowledge of the expectation of bedside handoff is depicted through careful evaluation of the nurse-to-nurse connection with the team as a whole. The practice and rationale for guiding practice strategizes the challenge, the expectation, and the consistency driven by shift. Leadership and managerial skills require evidence of the goal and objectives, plan insight, and knowledge of the plan. Leadership in support of practice change is essential in acknowledging the importance in involving the patient, family, and healthcare team. Leaders must be present in assessing the goal and recognizing the consistency and possible lack thereof. The presence of supporting policy change are involved. Providing constructive feedback through monitoring and research based on information is essential for the bedside nurse to understand policy change and developing the tools to strategize the communication. Healthcare facilities are growing in numbers for the importance of peer review, and with this pressure from lateral perspective bedside nurses, evaluating practice based on the tools and guidance developed. Support for the goals and objectives are no longer kept to organizational standards. They are publicized on the internet through patient satisfaction reviews, emails from providers to assess feedback from an impartial point of view following discharge. Healthcare research and quality guides the basis for rationale and support of bedside handoff. This study guides the practice and helps patients and families as the bedside nurse's working partner with care. Bedside handoff report benefits patient and family involvement. Developing knowledge based on understanding and care through explaining the patient role benefits consistency in care, assists in patients and examples on how to call the nurse, teamwork in their care, and develops relationships and decreasing the feeling of abandonment during shift change. Communication is crucial in the healthcare field, and developing a plan for the expectation of the possibility of change can be vital to the insight and delivery of care. Knowledge of the plan is not always clear. However, when the plan is unclear, obtaining information for creating connectedness in care far outweighs the uncertainty in care delivery. Searching for the answers is not always easy to achieve. Seeking out resources in the medical record can be a good source, as well as calling the physician to obtain information assistance and acknowledging the family and patient as the importance in their care. Through knowledge gains empowerment, with expectations facilitating the importance of care delivery beginning with shift handoff. In conclusion, bedside report handoff is epic to caring for the client. Clear communication and involvement from all involved parties are essential to care. Creating change in the culture from nursing station report to bedside report with a clear delivery system develops a relationship with the client and family, representing an investment in their care and decreasing possible adverse events. Creating a strategic plan based on mission through referencing stakeholder goals creates driving forces to enhance success. Success is delivered through a connected impact of operational process, stakeholders, and goals. This connection brings rise to opportunity financially, customarily, internally, and through knowledge and growth within. Creating support and communicating the plan is essential in developing and maintaining policy of 100% compliance to the bedside for report handoff. Demonstrating strategies with formal and informal channeling of the knowledge and understanding creates goal attainment through support based on knowledge and evidence-based findings. Leadership at all levels of care, beginning with the bedside nurse to managerial level of oversight, must be in accordance and understanding of what the policy demonstrates. With this knowledge, great things can become reality. Thank you and have a great day.